Dr. Wen and Planned Parenthood reportedly parting ways over the organization's abortion first philosophy. Wen also accusing the group of hypocrisy for, she says, trying to silence her. Let's get reaction from Republican Senator from Tennessee, Marsha Blackburn, who serves on the Senate Judiciary Committee. Senator, good to have you with us.
Good to be with you.
Of course, you have a deep knowledge of this as well because you were part of an investigation over on the House side when you were a member there into Planned Parenthood's practices. What do you make of what we've heard from the now ex-president saying basically she wanted to have an overall health care philosophy? They didn't want to give up the fight of abortion first as their philosophy.
Right, and they are abortion first. This gets to the heart of the argument about Title X funding and the legislation S-105 that I'd filed at the first of the year, which says, look, if you do abortion services, then you cannot get Title X, which are women's health care funds. And so Planned Parenthood couldn't get those funds, and because of an executive order from President Trump, and that cost them about $60 million because they were not willing to give up abortion first. But I got to tell you, listening to this statement from Dr. Wen and following this story, don't you find it so ironic that they are trying to silence her voice, and she's complaining about her voice being silenced when Planned Parenthood has silenced the voices of millions of babies. And I just find this so ironic.
Yeah, and of course, their side of the story, or what some sources are saying, is it was a management issue, her management style, that kind of thing. So this is her side of the story. They also, you mentioned Title X. They say they've been forced out of being able to receive federal funding because the family planning money and the health care money will go to those clinics that do not perform abortions or refer for abortions. Here's what they say on their website, Planned Parenthood Action Fund. When politicians talk about defunding Planned Parenthood, they really mean blocking patients who depend on public health care funds from getting their care at Planned Parenthood health centers. How do you respond?
There are a few hundred Planned Parenthood clinics in this country. There are over 13,000 women's health clinics, community health clinics in this country. And when Planned Parenthood doesn't get money, and that money is fungible, then those dollars are going to end up going to those community health centers. That is where the greatest need is. Our goal is to make certain that women who are underserved have the ability to receive access to health care.
Okay, we know that that legal fight on their part is not over. I want to ask you about a couple of other hot topics while we have you. Okay, so guns, where are we on that? We hear that there's a lot of negotiation going on behind the scenes. Senator Chris Murphy tweeted this. He said he just finished a meeting with Attorney General Barr and Senator Toomey and Joe Manchin. It was a really good discussion, but the fact remains that there's no good deal that the gun lobby will support. So now the White House has a choice to make. And there is a statement out there from the NRA basically saying what they're seeing floating around this one pager is not something that they can get behind.
What we do know is that not any of us want someone who's a danger to themselves or others to have access to any kind of weapon, firearm included. We also realize that it is important to address this issue and not take away Second Amendment rights. People who are every day exercising their Second Amendment rights and doing it within the law, we ought not to affect them and their ability to exercise that right. What we have to put our attention on is some of the mental health issues. When you look at the 2016 DOJ study and you look at how people got their firearms, and so few of them got them from a licensed firearm dealer, but when you look at the issues of mental health and talk to law enforcement, they say drug addiction, mental health, that needs attention when we talk about these issues. Likewise, law enforcement wants to have access to information about juveniles who have had records. And when they turn 18, all of a sudden law enforcement does not get those records. They also want to know when there's someone in their community that has failed a background check and didn't clear the NICS system. Now, Shannon, those are things that we could do. There is agreement on that. Those are the steps that we should take immediately.
Well, we'll see if something comes together that the Senate Majority Leader McConnell will put to the floor. He says he will only do it if the president is backing something.
That's right.
So we'll wait and see in the coming days. Senator, thanks for stopping in the meantime.
Good to be with you.